Well, the committee itself was formed on a nonpartisan basis. Members from the major parties got together, recognizing the need for us to have more information and more plans as to how to deal with palliative care, hospice care in this country, with suicide prevention and with elder abuse. Those were the three major areas that we worked on. Coming away with a report that establishes background information on this data and statistics in some cases, principles and policies in others. So for instance, with regards to suicide, identifying that we have over 4,000 or roughly 4,000 suicides a year in Canada, much higher than a number of other industrialized countries. Very high rates amongst First Nations youth and our youth generally. So we know there's specific areas that if we had a national plan to prevent suicide, part of this is public education, part of it is treatment facilities, services, we could lower the suicide rate. We developed this plan for the world. We gave it to the UN, and the UN passed it out to a number of countries who were very successful in reducing their suicide rates. So we know it can be done. On the palliative care area, we know we're grossly underserviced across the country. In spite of the tremendous work that people do, the caregivers provide, both professional and family and friends, we need to have a better system, and we need to develop that system so that it covers all areas of the country. We have areas, for instance, in Toronto and Montreal, where there are very good hospice palliative care services. You can cross the street into another municipality, local municipality, and not have any services at all. And for those of us who believe strongly in a national Medicare system, that's just not acceptable. So that's one of the areas that needs to be worked on. We need to do a lot more work on pain management. Our doctors and nurses aren't well enough trained, both while they're in school and when they get out. And we know there are programs that can increase that knowledge to make end-of-life decisions, end-of-life planning, and their comfort levels. We can reduce the pain that people suffer in life in that area. But there's other areas that we know if we had a national palliative care strategy that was implemented across the country, that we could make end-of-life both decisions and care much better than it is at the present time.